welcome to our member meetup today. Today I have Micah Hunt here with us from Physical Therapy and Balance Center. Micah, tell us a little bit about yourself and your business.
Yeah, I've been a physical therapist for over 17 years now, and I started this company about 14 months ago, where we see people for balance and for orthopedic injuries like neck pain, back pain, and all that other stuff, but post-surgical, pre-surgical. But our place being a balance center, we can work on people who have vertigo or just have a lack of balance to help them get back to living the life that they want to live.
Right. I remember we were here about 14 months ago doing a ribbon cutting for you guys. So it's come a long way. It looks great. So I like the balance part of it. So maybe you could show us some of the tools that you use for that.
Yeah, definitely.
All right. So tell us about this piece of equipment for the balance.
Yeah, so we want to challenge people's balance in a safe manner. So we feel the best way is to put them in a harness that attaches to the ceiling, holds up to 500 pounds. And that way we can really see where they have issues with their balance, but do it in a safe manner, like I said. And we also have a force plate down here, which tells exactly where they have their issues, if it's with eyes closed, eyes open, moving their head, and all of that. And then it does it objectively, so it's not just me observing them saying, oh, I think you have bad balance.
Right.
It's telling me in numbers where they have an issue. And so it's something I can also send to physicians, and I can show the patient, hey, this is where you were when you started, this is where you are now, look how much you've improved.
Right.
Yeah, so it's really makes it easy for me, and it makes it so the patient can see, wow, I am making progress, but maybe they don't think they're seeing it when in actuality they are.
Yeah, that's awesome. So, and you had mentioned to me VR goggles, so, and you had said that like they have, if there's a trigger like in a crowded shopping center or something, so is that what they see when they wear them?
Right, so I ask them what their triggers are for their vertigo, or maybe they're anxious about certain scenarios, and so I can pull it up on the VR goggles and they're in the harness as well. And then, so some people, they have a trigger where they drive at night in the rain with the windshield wipers. So we can have them in that scenario in the harness, learning it safely. And so when they get out there, if they're in that situation again, they don't react how they might without the training here.
Nice.
Yeah, and it's pretty fun for them, because you can also do things that challenge them, but it makes it more fun. It's kind of like a game.
Right.
So it's not doing the same thing, looking at the same pictures over and over.
Yes.
It's a real life situation.
That's great. And because I'm a patient here, I've seen it in action. So it's really cool how the patient feels that security of your harness and being held there, so that they're not.
Well, and it feels it's good for me, because I'm not concerned at all about them falling.
Right.
Like their safety is guaranteed, so that I can sit back and observe instead of monitoring them and making sure, they don't fall. And so I don't worry about getting hurt. I don't worry about them getting hurt. Just kind of a win-win both ways.
Right. That is excellent. So let's talk about some other areas of your space here that you utilize for patients, maybe like post-surgical things. Like what would you do, I don't know, for a total knee replacement?
Right. So for a total knee, the best thing is to get range of motion back as soon as possible. And so obviously we have the recumbent bike, we have the new step machine. What we try and do is recreate a real world situation. So if someone has issues with going up and down stairs, if they have an issue with their balance with that new knee, we work on that as well. And we also have, because it's a balance center, we also have other areas we can really challenge their balance. And so if they're walking on like wet grass or sand or whatever, we can really challenge them and get that balance back safely.
All right, so let's talk a little bit about how people would get in contact with you and how they would become a patient of yours here.
Right. Well, fortunately, this past year in Missouri, they passed a law that you no longer have to have a prescription to start physical therapy. So you can just contact us either by phone or fax or by email, or even just walk in and we can get you signed up, and you don't have to go to your doctor. So it saves you money and it saves you time. You can get in here and get the care that you need.
Get started without having to get that referral. That's right.
Right.
So I know it's probably different based on injury or what they're seeing you for, but what's a typical time span that someone would be a patient here with you?
Yeah, that is a difficult one, because it depends on the severity of the injury and the quality of their health and all of those other factors that go into that. So 4 weeks, 8 weeks, it depends on what's going on. A total knee would be 12 weeks, but it depends on how active they want to be.
Right.
If they live a sedentary lifestyle, we're not going to have to do a whole lot to get them back to that lifestyle.
Right.
But if they're playing tennis or whatever, we're going to have to get them back to doing that safely and build up the strength and the balance so they can get back to living that life.
The life that they had, yes.
Yep.
All right, so I'm really glad we got to come out today, but I want to give you the opportunity to share any last minute tidbits you want to share with us before I let you get back to work?
Well, I just feel like I've really been supported by the community around here, and being a small business owner, telling each other and telling their friends, telling their doctors, it's been very very heartwarming, and I'm quite appreciative. That's what I'd like to get out there.
That's awesome. Well, Micah, I'm glad I got to come visit you today. Thank you.
Me too. Thank you.